Welcome back, everyone. I'm pleased to hand it back to Jenny to introduce our second keynote speaker, Dr. Kris, and to moderate the session. Jenny, over to you.
Perfect. Thanks, Exar. Hi, everyone. Welcome back again. Hope you had a good break. I'm very excited and honored to have Dr. Kris here with us to present our second keynote of the showcase. She likely needs no introduction to a lot of people in this audience here today. She's well known across the climate and health spheres and has been conducting research and practice on the health risks of climate variability and change for over 30 years. There are many accolades that I could review about Kris right now, but the two most recent awards that are connected to our AGU AMS Health Showcase today are Kris being named as a 2023 AGU Fellow for her fundamental and innovative contributions to research within the AGU and assessment and applications of health-related impacts of climate change. And then a second award she won in January at the AMS was the 2024 Kenneth Spengler Award for her visionary and tireless efforts and dedication to elevating the connection between climate and health with a prime focus on investigating how these essential issues impact human resilience. So we're very excited to welcome Kris today to provide insight on adaptation and health co-benefits of mitigation. So I'm going to share Kris's slides for her. She is traveling right now. And so we thank her for being here with us, and I'll get these going. And Kris, just let me know when to advance.
Thank you, Jenny. I really appreciate that very kind invitation, the introduction and the invitation to talk with you. And my apologies to everybody. I'm sitting in Chicago International Airport, and this is the best we can do. So I will talk through my slides from my phone. Happy to answer questions that you have, of course. And thank you, Jenny, for organizing this and for making my slides advance. I want to start with the framing on the left. The picture is a framework that's been used by the Intergovernmental Panel on Climate Change for about 20 years. And it basically sums up that as we're looking to the future, we're looking at risk, where risk is probability times consequence. And in the IPCC framing, there's three major factors that together form risk. I'll turn it into four. The first are the hazards created by a change in climate. The second are the human and the natural systems exposed to those hazards. And the third is the underlying vulnerability of those systems. For health, I think it makes sense to separate vulnerability into the susceptibility to harm and the capacity of our health systems to manage. And this is just a reminder from Adobe Acrobat that something needs to be done. But this is just a reminder that when we talk about climate change and health, we talk about a lot more than just the hazards. We talk about everything else as well.
Sorry, I don't know. It won't go right now. Okay, let me do this again. That's funny. Okay, go ahead.
That's great. And so this slide is a summary with a little bit more detail from the health side about those interactions that together form the risk. And on the bottom has a very short list of some of the climate-sensitive health outcomes, many of which you heard about today. Next slide, please. I want to spend a minute on this. These are iconic figures from the IPCC, Intergovernmental Panel on Climate Change, that have been used again for about 20 years. I want to talk with you about them because they're incredibly familiar to the IPCC focal point. They are well understood and they're well appreciated by the policymakers. When you look at these figures, the zero line are pre-industrial temperatures. The y-axis is increase in temperatures above pre-industrial. You can see it goes up to 4 degrees C. The gray bar are current temperatures, at least when we're now up to about 1.2 Celsius above pre-industrial. Where each of these bars is white, it means that scientifically it's not been possible to determine whether and I'll use heat-related mortality as an example, has shifted because of climate change. We don't have enough data, we don't have long enough data series, nothing's happened. We just don't know. When the color turns to gold, it means that, in fact, climate change is altering that system. When the color turns to red, the risk is high. When it turns to purple, it's very high. Creating these figures requires quite a bit of scientific analysis and assessment. And what we're really looking for is where are those transitions. And so you can see there's fuzziness with each of the transitions, but that's where we focus our science, is where are those transitions. The program we use to create these puts those dots at each of the transitions. The number of dots tells you the level of confidence. More dots, more confidence. So that's the basic outline. Because of the color scheme, we call these the burning embers. You can see that for each of these health outcomes, there's 3 steps, and this is the first sector that took this particular approach. And so these assessments were done under 3 scenarios. 1, a world with limited adaptation. The second, a world with incomplete adaptation. We just muddle through, do some things okay, some things take too long. And a world actually aiming to sustainable development. For the incomplete and the proactive adaptation, the temperatures are capped at the temperature projection in 2100 for those scenarios. And while I've been talking through this, you can clearly see how powerfully this figure illustrates the importance of adaptation and mitigation. We have to do both. And these are a set of figures being used by governments worldwide to help think about the policies that they need to implement to move towards resilience, focusing again on adaptation and mitigation. Next slide, please. WHO, of course, has frameworks around climate resilient health systems. The focus has shifted within the last couple of years to climate resilient and environmentally sustainable health systems. I apologize for the low quality of this figure, but it's the best you can get out of the WHO document. The left shows you the basic building blocks of health systems, and the right shows the major categories in which we have to think about environmental sustainability. This framework is being used by world governments, ministries of health worldwide. Next slide, please. This is how WHO summarizes the climate resilience and the environmental sustainability. It points out that for adaptation, the first step is conducting a climate change and health vulnerability and adaptation assessment, which I'll talk about in a moment, developing national adaptation plans for health, and then facilitate access to funding in this space because we just haven't really had any. Environmental sustainability is getting to net zero and making sure that we reduce the emissions from our healthcare system. Worldwide, healthcare is responsible for about 5% of greenhouse gas emissions. Airplanes are responsible for about 2% of emissions, and they get a lot more attention than our healthcare system. Here in the United States, our healthcare system is responsible for about 8% of our greenhouse gas emissions. Next slide, please. This is a further detail on the WHO framework for promoting climate resilient health systems. The top of this figure very similar to what I showed earlier, and the bottom goes into a little bit more detail. One of the areas in which there's been a lot of emphasis is on developing early warning systems. Next slide, please. There's a long list of very effective adaptation options to increase resilience of our health systems. I've listed a few of those here. I'll mention a few of them. We can talk about them later if there's questions. And noted at the bottom, a major constraint is limited investment. When one looks at the adaptation funds under the United Nations Framework Convention on Climate Change, less than half of 1% has gone to health. That is going to shift. There was pledges made at the last conference of the parties, so hopefully we'll see a big change. But at this moment in time, it's important to understand there's been so little investment at the same time that we know that people are suffering and dying from climate change. Next slide, please. So these are the basic steps in conducting a vulnerability and adaptation assessment. WHO has two guidance documents on this, one released several years ago and one that was just updated. It's important for entities, ministries of health, departments of health to start with understanding their strengths, their weaknesses, and how those are going to interact with the changing climate. And from that, then to make recommendations about the changes that are needed so that going forward, we're much better prepared than we are today for extreme weather and climate events, vector-borne diseases, changing their geographic range, all those kinds of issues. Next slide, please. I want to spend a few minutes on early warning systems. If you're not aware of the World Meteorological Organization, last year started this initiative on risk and early warning systems for all. There was an evaluation of the program last year, and you can see it helped protect an additional 111 million people. They're hoping to reach even more this year. And so there's this big emphasis, and there's a large amount of money, as you can see, going into early warning systems, indicating there's many opportunities in health to further collaborate with meteorological services to help save lives, save livelihoods, and improve health outcomes during extreme events. Next slide, please. Unfortunately, I couldn't call in earlier, but if you haven't heard about, there is a global heat health information network that is quite active. This is just a screenshot of some of their case studies showing different places where early warning systems, heat action plans are being implemented. There's lots of case studies. You can see one highlighted here from Malaysia of how to ensure that these systems take an all-of-society approach and are built on the local context. So they are most effective as possible, given we've got large increases in heat waves, much larger than what people are typically expecting, and a lot that needs to be done to help save people's lives, avoid avoidable hospitalization. Next slide, please. This is a nice summary published quite a few years ago showing some of the value in the health side of developing early warning systems, of understanding where the interventions lie. And you can see there's a range of factors that can modify, decrease vulnerability in a number of different sectors. Not all of this is in the health sector. It shows that, for example, heat exposure, you've got spontaneous adaptation, you've also got planned intervention. And think about how to use those then as you go through that causal pathway from exposure to mortality and identify places where with intervention we can decrease the number of people who are adversely affected in a heat wave. Next slide, please. I'm sure you've talked about this extensively today, but heat is a key example for talking about health inequities and how they're at the very core of adaptation. That when adaptation options are developed, how critical it is to engage directly with the communities being affected and make sure that whatever options are selected are going to promote the resilience and reduce the current inequities and prevent future inequities from developing, particularly in this case from heat, but that's true also for other climate-sensitive health outcomes. Next slide, please. An example of an extensive heat wave early warning system is this heat wave plan from England. I'm just putting this in as an example. I've listed the core elements. They actually have 4 alert levels that are based on the context in the UK. This is what works well for them. The system has been in place for quite some time. and it's been quite effective in saving lives. Although last year there was a major heat wave, much more extreme than anything that has been experienced for more than a decade. And it was not completely successful in saving lives, pointing out opportunities for continuing to improve these systems as temperatures continue to rise. Next slide, please. One of the elements I find quite interesting in this plan is this figure that just shows the cascade of alerts. Which groups are involved, how alerts go from one group to another group. All of this has been extensively worked out. And if you're working with a group that's developing a heat wave early warning system, it's a nice example to work through to help people think of the different groups, to think how they interact, and how that chain flows from a forecast into action, into helping prevent adverse events. Next slide, please. There's lots of ways people can stay cool without air conditioning. In the U.S., really only the desert Southwest is a region where air conditioning is required in very extreme events. This is a slide from a paper written by Ollie J., published in The Lancet a couple of years ago. A nice summary of the different ways that people can stay cool without that access to air conditioning. And these are particularly applicable in low resource settings to make sure that we protect people to the extent possible. The figure on the right then shows you different settings and what can be done in different settings. Next slide, please. In thinking in the longer term, there's lots that needs to be done about our urban infrastructure. This is a recently published paper, obviously in Europe, looking at the urban heat island. And there is a directive in Europe that all cities should have at least 30% tree coverage. And so pose the question of what if the cities actually achieve that and how many deaths could be avoided. The answer is quite a large number of deaths could be avoided just by having cities in Europe achieve this mandate. And it's one of many changes that we need in our urban infrastructure, and starting to see the literature coming out, quantifying the benefits of this to help move policy. Next slide, please. WHO categorizes health systems on those two dimensions of climate resilience and environmental sustainability, particularly low carbon emissions. The ideal is high health systems performance and low greenhouse gas emissions. That's the target at the bottom. And then categorized everybody, all countries, into these different categories, pointing out that particularly in very low resource settings, in low and middle income countries, health system performance is low, greenhouse gas emissions is low. And so the priority in those settings is focusing on resilience while adopting, as they can, low carbon technology. We, of course, are in a country that has high health system performance, high greenhouse gas emissions. And so the focus here, while we're adapting, is also to make sure that we reach net zero, and has some guidance for countries as they look at their pathway and find the most effective way forward to help improve population health and well-being in their setting. Next slide, please. I'm now going to move on and make a few comments about mitigation. This is, from my perspective, the most depressing slide I have. It shows you fossil emissions from 1990 till today, and just clearly showing that not much has affected that trajectory. Major events have occurred around the world and really haven't made much difference. And this is why you keep hearing more and more urgent calls from scientists, from the UN Secretary General and others about how important it is to get our emissions under control. Next slide, please. This shows you the changes in emissions from 1990, again emphasizing that the major increase has been from fossil emissions. The other categories, of course, are methane, nitrous oxide, the fluorine gases, and the green is land use change in forestry. But the major increase is from the fossil emissions. Next slide, please. This shows you the change in atmospheric CO2 concentrations from 1960, and it completely parallels our emission trajectory, just reinforcing it's our emissions that are driving these increases in CO2 concentration. Next slide, please. These show the major emissions by source. Unsurprising, it's coal and oil that are the most important. Their level of importance is varied over time. Right now, coal is more important than oil, but sometimes it's oil more important than coal. You can see the large increase in natural gas. There's been a big switch to natural gas because it's economically desirable. It's not free of greenhouse gas emissions. And so as there's a greater shift to gas, we're going to see a greater contribution to our fossil emissions from gas. Next slide, please. These show you the top emitters by source. You can see after 2000, China has just rocketed up with their emissions. You can see the U.S. has brought our emissions down a little bit, but not as much as Europe has. You can see India's emissions are increasing. Overall, just these 6 emitters cover 2/3 of all the global emissions. Next slide, please. What's critically important in the negotiations from the perspective of low and middle income countries is looking at the cumulative emissions, because what's driving climate change is the accumulation. It's not just this year's emissions, it's the total burden of emissions in the atmosphere. The U.S. is responsible for about 20% of all of the emissions in the atmosphere. The U.S., the EU somewhat less. You can see China is rapidly increasing, and this is why in the negotiation there's so many calls for the U.S. to take leadership. Next slide, please. There is a field that looks at the carbon cycle, and part of what they look at is the sources and the sinks. We know the sources, and the sinks, of course, are not just the atmosphere, but our biosphere, and about 25% or so of all emissions go into our ocean. Next slide. This is just further detail on the global carbon cycle, showing the sources and the sinks, how they interact. And this information, there's been decades of research on this, can then be used to take a look at our current carbon budget if we want to stay below certain temperature rises from pre-industrial. Next slide, please. And before I do that, I want to put in 2 slides about how complicated it is to actually calculate emissions. At the global scale, it's pretty straightforward. At the national scale, it's much more complicated. This just shows the flows from production to consumption. And you can see the very large arrow going from China to the US. And what you hear sometimes is China saying, all of those emissions you say are our emissions, well, we're manufacturing things for you, the US and Europe, and that actually the emissions from that production should be assigned to the US and to Europe. Next slide, please. And this goes from extraction to consumption. And so you can see extraction from multiple places, including from Australia. They sell a lot of coal to China. And so you can imagine this is just parts of the puzzle about calculating national emissions. And I put this in because how emissions are calculated, as I keep saying, is very, very complicated, and how you take different issues into account. And yet what you read in the media is really simple. And when you hear those numbers, I just want you to understand that's not the whole picture. There's more to this, and understanding this picture is important for the negotiations, important for prioritizing action to reduce our overall greenhouse gas emissions. Next slide, please. As I mentioned, you can use what's known about the carbon cycle to estimate the remaining carbon budget. And this is the second very depressing slide I have. Shows you historic emissions just from the year 2000 and shows you the pathways to keep warming below 2 degrees, 1.7, or 1.5 degrees. I've showed you the increase in emissions from the 1900s. There's nothing that looks like this. There's no precedent for bringing these emissions down so quickly. And yet that is what needs to be done. Next slide, please. This is another way of saying the same thing. It just shows you what the carbon budget is in 2495 with a 50% probability of staying below these particular temperature thresholds. Just again emphasizing the remaining budget is really very small. Next slide, please. And the story, unfortunately, is even worse than that. This shows you committed emissions from existing extraction infrastructure and existing consuming infrastructure. And showing just from this perspective, it seems improbable that warming can be kept below 1.5 degrees without a major transition in our energy system. Next slide, please. Every year, the United Nations Environment Program puts out the emission gap report, which is a synthesis of much of what I've just said. I put this in here so you could have a visual image. If you're interested in finding out more, the emission gap report is really very useful and shows, as in this figure, the gap between our current commitments and where collectively countries have said we would like to be. Next slide, please. And with all of that, of the seriousness of the situation, of the challenges that we face, one significant contribution, besides getting our own emissions under control, from the health sector is to highlight the health benefits of climate action. This is a busy slide from BMJ from several years ago, and it just highlights that essentially all mitigation policies have health benefits. You can think of coal-fired power plants. There's thousands of publications showing that children that live downwind of coal-fired power plants have higher rates of asthma, higher rates of allergies, more hospital admissions, that adults downwind of coal-fired power plants have higher rates of respiratory diseases, cardiovascular diseases, higher rates of hospitalization, higher premature mortality. And it's possible to calculate, if you reduce those emissions, if you eliminate that coal-fired power plant, how many avoided hospitalizations, how many avoided premature deaths. And those can be valued. And the value of those is of the same order of magnitude, if not larger, than the cost of mitigation. The same is true for having people taking up active transport, walking and biking. The same is true for altering our diet so that people do not eat more red meat than their doctor recommends. And all of those collectively bring really significant health benefits that occur faster than the benefits for the climate. Next slide, please. This is a summary from Catherine Bowen in major categories, just again highlighting what I just said, but giving you specific numbers, showing the value for these benefits. And the aim is trying to get this information out so that when we hear that mitigation is going to cost X, the next sentence is, and the health benefits will be X plus whatever the numbers are, and making sure that people understand we should be mitigating for our health. Next slide, please. This is one of many examples. This was some analyses looking at the number of deaths avoided attributable to PM 2.5 concentration in 2040 under the Paris Agreement. There's a couple different scenarios here. I won't go through these, but you can see for all of these scenarios, the number of deaths avoided is very large. Again, the value of mitigation for our health. Next slide, please. This is an example from Wisconsin, looking at the value of clean energy for Wisconsin in terms of created jobs, increases in GDP, and substantial health co-benefits. This, in this case, is valued at $21 billion by reducing air pollution. Next slide, please. And so in summary, I've talked about adaptation, I've talked about mitigation. There's big challenges to both, and yet there's a lot that's already started. And this slide is an overly complicated slide from the IPCC, just trying to point out that the future is in our hands. There's a range of decisions we all need to make individually and collectively. And it's just not one decision. It's going to be decisions over time that we're going to see various inflection points where the decisions will lead us to different pathways. And the more we commit to sustainable development, investing in adaptation and mitigation, the better population health and well-being will be going forward. With that, thank you very much for listening, and I look forward to your questions.
Great. Thank you so much, Kris. So I think we have time for questions. I'm just checking the chat here if any have been added. No, I don't see any. If anyone has a question that you would like to ask Dr. Ebi while we have her on the line, please go ahead and you can unmute and just ask or raise your hand or add it into chat.
Thank you,
I'm always
Kris.
suspicious. Oh.
No, that's fine. I was just saying thank you, Kris. This is Gabe Filippelli. I see you're juggling quite a bit, but I was wondering if you could reflect a little bit on how effective a health-based argument is for spurring action on climate versus the standard economic-based one. I know they're related to each other, but you have vast experience in this, so I'd love to hear just a few of your thoughts.
From what evidence there is, the health argument's really important. Health has been bubbling along below the radar on climate change issues. And at the last conference of the party of the Framework Convention on Climate Change, that was in Dubai in end of November, early December, there was a health day for the first time. And part of that health day included pledges from the Green Climate Fund, from others. And they're significant. They're pledges. They're not actual cash. They're pledges of $1 billion. And it was the first time, really, it started to get through to negotiators that health is a powerful argument and that health can encourage people to take action. We know how hard it is in health. We know the problems of getting people to change diets. On the other hand, we've had a lot of experience with how to get people to change diets, how to change behaviors. And so there's increasing uptake on the mitigation side of using the health argument to say it's not just about the cost. It's also about you, your family, your friends, your children, about your own future. And that argument seems to be gaining traction in this space. And so I'm hoping we're going to see more uptake of this going forward.
Thanks so much. I appreciate it.
Thank you. Any other questions? Kris, I'll ask you a question while we have you. I think it connects to the last question as well. Just thinking about how can we quantify some of these things better around health and vulnerability and risk. And working group 1 and working group 3 seem to have a lot more quantitative data to work with around some of these issues, where working group 2 on vulnerability and adaptation may not have that quantitative data that can really make the case for the needed changes or what we might see with different adaptation strategies to support decreased vulnerability. And I wonder if you have any ideas on studies that could be helpful from people on the call to help with some of these ideas or putting forth recommendations for the IPCC to better make decisions for adaptation strategies.
So that's a really good question. And part of the challenge lies in the health sector itself, because we don't have as much of a culture of doing those kinds of analyses. And so really ensuring that we take more of a focus on how can we better quantify. And I think there's lots of opportunities to do so. There's lots of health data that hasn't been explored. But Jenny, you know just how much weather data there are that people have never looked at from the health lens. There's so much that we could do. A real challenge has been the lack of funding. And I think the reason much of those analyses don't exist is not because they're not possible, it's just because nobody's funded them. And that's starting to shift. We now have a climate and health strategy under NIH. There's been pledges, as I said, large pledges at the COP for further investments into health. And I think that will give people the leverage they need to be able to do those kinds of analyses.
Yeah, perfect. I agree. Thank you. We have a question from Morgan Goris.
Hey, Kris, this is Morgan Goris from Los Alamos National Lab. Thank you so much for your talk today. I'm going to ask you what might seem like an atypical question, but we had a speaker in our last session talk about the importance of acknowledging emotions surrounding climate change and encouraging us to ask our friends and colleagues and kids about their emotions surrounding climate change. And I thought, no better person to ask than you. So if you're willing to share, how do you feel about climate change, and how does that maybe influence your work and your research direction?
Yeah, I've always answered that question as I frame myself as a worried optimist. And what I do, particularly with my students, is point out two things. One is that we know from Yale's program, The Six Americas, that one of the major challenges we face in the US is how few people talk about climate change. 75% of Americans know the climate is changing. 2/3 think we should be doing something about it. 50% think their health is being affected. Only 1/3 of people ever talk about it. So the first is start discussions. It doesn't help anyone when we are all individually worried and we won't share. And then the second thing I bring up is I live in King County, and there's so many opportunities to find groups that have similar concerns to what you do. In King County, every other year, there's what's called a Green Globe Award that the administrator of King County confers to 12, 20 groups, individuals, and those are pretty heavily publicized in our media. If you're worried about the salmon, there's groups that are helping save our poor little salmon fry. There's groups that are cleaning up rivers. There's groups that have worked on climate action plans. There's all kinds of ways the students can get engaged with others who are trying to make a difference. Because ultimately, what we need is everybody engaged in whatever they're interested in around climate change, global environmental change. Not everybody's going to engage, but the more we collectively work on issues, the bigger the difference is going to be in our local environment. And it's also going to make a difference in our politics. We can't build political will if people aren't going to talk with each other about an issue. So a couple of things to think about in working with students and having them find ways to not only be able to express what concerns they have, but be able to then use those concerns into making the future a better place.
Thanks, Kris. And we have one question in the chat. We have 1 minute left. So if I'll ask this one, but it seems like a lot of people on the call might have ideas that they can share links with in the chat. But it's a question from Dana Sanders around resources found to be the most useful in convincing local or municipal leadership, especially in the underfunded red states, to address issues and perform vulnerability and adaptation assessments and planning. If anyone has ideas, Kris, I'll ask you first, or people can put links in the chat for Dana.
Oh, that's a great question. And for heat, there's lots and lots of resources. There's great resources from Maricopa County in Arizona on getting greater engagement around heat issues. It does go issue by issue. So for heat, there's lots more resources than there are, for example, for vector-borne diseases. But it would be lovely to have one place where those resources can be shared, and so that people can not start everything afresh, but can learn some best practices and use those going forward and just being more efficient in making change.
Perfect. And we'll try and share more throughout the next session. So with this, I'm going to wrap it up and thank Kris again for doing this talk for us and covering this while she's in transit at the airport in Chicago. Thank you so much, Kris, for sharing all of those resources. And you always find kind of the best infographics that are available that we can all be using in some of our teaching and research. So thanks so much. With that,
Thanks so much.
Yeah, thanks, Kris. I'm going to turn it over to Morgan Goris to start the next session.
Thanks so much, Jenny. All right, we have our fourth and final session of the day. We are on time, so I'm not going to delay any further. Our first presenter for this session is Miriam Marlier, who is joining us from UCLA, and we'll talk about population vulnerability in California to climate-related hazards. So Miriam, if you want to go ahead and share your slides, you can take it away.
Sure. Okay, is that full screen now?
Yes, looks great. Thank you.
Okay, so I was putting together slides for today, and I know it's a 5-minute lightning talk. So instead of talking more broadly about the many climate-related hazards that face us here in California, I'm going to focus specifically on a project that we're currently working on that's looking at wildfire-related vulnerability. So California, as with many other locations in the Western US and around the world, is experiencing large increases in burned area. There's been a 5-fold increase since the early 1970s. And this is a trend that is expected to continue in the future with climate change. And in the study that I'm going to share today, we focused on fires specifically in the wildland-urban interface, or the WUI. And this is where wildland vegetation and human development meet. So this figure on the right, this is showing total burned area in light green, and then the WUI specific burned area in the darker green shade. So you can see that WUI burned area is a relatively small proportion of our total burned area in California, but it overlaps with communities. And these communities and their health could be affected in several ways. This could be either directly through the physical presence of fires, building damage, or loss of life, and indirectly through exposure to air pollution. So this includes fires that could be burning, sorry, I'm seeing something in the chat. Oh, sorry, okay. This could be fires that are burning close by or pollution that was transported in the atmosphere. But we currently lack exposure maps of the balance between these direct and indirect fire threats in WUI areas. So that was a gap that our study is looking to fill. So in order to map these different categories of exposures, we use geospatial data that's shown on the first panel to map the WUI and population characteristics. Then we look at direct fire threats. So that's measured through burned area, building damage, and civilian fatalities. And then indirect fire threats, which we measure through smoke pollution exposure. So in the next few slides, I'll provide a brief overview about our approach and some of our results. So first, considering what we're terming direct fire exposures. Our study period was from 2008 to 2018. And over this 11-year period, we see variations in burned area over time. So most burned area is in areas with very low or no housing density, shown in these orange shades here. And WUI burned area comes next, and that's shown here in this dark purple line. So even though it's a much smaller area, what we also found in our study is that nearly all of the building damage and civilian fatalities are coming from fires that are either located within the WUI or cross partially into the WUI. And next, what we did is we assessed indirect exposures through the contribution of wildland fires to fine particulate matter or smoke PM 2.5. And we did this with CMAQ model simulations. So the map on the left is showing average smoke PM 2.5 in the WUI over that same 11-year period. So we can see differences by our different climate zones here in California, with particularly significant impacts in Northern California. And the chart on the right is showing the same data, but now it's broken out by year. So you can see both the changes over time from year to year and among these different climate regions. And finally, we consider these patterns together. So analyzing the combined patterns due to direct fire exposure, so that's measured here on the left, and indirectly shown on the right. So for WUI areas that experience at least one fire in our 11-year period, we see hotspots north of us here in Los Angeles, as well as in Northern California. And the heaviest smoke burden was in Northern California, with a total count of the number of days above the EPA standard, just due to the fire contribution approaching 100 days in some areas. And in this work, we've also identified certain communities where there is overlap between direct and indirect exposures, how this varies by population characteristics, and factors that could contribute to sensitivity to various health effects. So in this work, we found that although WUI fires are a small subset of total burned area, they make up the direct health impacts measured by building damage, exposure to fires, and civilian fatalities. Those are forming the bulk of the impacts in WUI areas versus non-WUI fires. But what we saw also was that the exposure patterns between the direct and the indirect exposures measured by air pollution differed across our different climate zones. And in future work, what we hope to do is to refine our analysis to tease apart different contributions to air pollution, considering prescribed burns and agricultural fires separately from wildfires, and connecting this to different vulnerability metrics. And that's all I have. I would like to recognize our funding from NASA, and I know I'll be happy to answer some questions at the end.
Thank you so much, Miriam. Really appreciate it. Our next speaker is Ryan Calder, who is joining us from Virginia Tech. Ryan will speak on identifying health trade-offs for policy-relevant geoscience and engineering research. So Ryan, the floor is yours.
Thank you very much. Can you guys see full screen?
Yes, we can.
Okay, perfect. Yeah, so thank you for the introduction. I'm Assistant Professor of Environmental Health and Policy at Virginia Tech. My group develops models to characterize environmental health and economic trade-offs in the setting of land management and the energy transition. And we tend to work backwards from policy dilemmas to uncover strategic opportunities for environmental research, which we then carry out in concert with various disciplinary experts and policymakers in need of decision support. And I wanted to spend the next 5 minutes talking to you a bit about how that has played out in the context of untangling the role of hydropower development in human health, which is a line of work that I've been pretty actively pursuing since my PhD. So Canada has vast hydropower resources, and there's a big literature describing how further integration between Canada and the US can likely lower costs associated with the renewable energy transition, either by using Canadian hydropower to buffer intermittent renewables in the US or by supplying baseload. And this is playing out mainly in the west and east coasts of the US, where hydropower imports are increasing quite quickly. And on the one hand, hydropower might displace fossil fuel generation in the US, bringing health benefits on the short term through reduced emissions of ambient air pollutants, such as particulate matter, and also on the long term by reducing greenhouse gas emissions and reducing climate-linked health impacts there. There's also the fact that reservoir creation has many adverse impacts, overwhelmingly on local indigenous populations, and this includes the production of neurotoxic methylmercury. There's also the fact that reservoir construction releases methane, which offsets some of the climate benefits. And a lot of my work has basically revolved around the development of models that evaluate how human health is affected by different policy levers that affect different parts of that system. Again, working in partnership with the people most affected, including Indigenous communities in Canada, and also policymakers in the United States. So, for example, one set of research questions my colleagues and I have addressed is the role of new hydroelectric development and the methylmercury issue, exposures of indigenous populations to methylmercury produced in newly flooded reservoirs, which occurs through contamination of local fish and seafood, and also looking at whether fish consumption advisories, which are the default policy response, are in fact health protective. And so prior to this research, the sort of hazard of methylmercury at hydropower reservoirs had been known, but there was a lot of debate around the significance in the context of overall exposures and whether or not fish consumption advisories were a good thing to do or not. So in a partnership with the Inuit of the Labrador Coast, we're facing hydroelectric development upstream from their traditional hunting and fishing territory. We developed a novel integrated model that synthesized biogeochemistry, fate and transport, and human exposures modeling to characterize cardiovascular and neurodevelopmental risks from methylmercury. We also modeled dietary scenarios that cross-referenced dose response functions from nutritional epiliterature to figure out net health impacts on those risks from low likely fish consumption advisories. The very abridged version of the results is that hydropower development poses material risks for people who consume large amounts of local foods in a way that's pretty poorly captured by existing human health exposure assessment methodologies. But also that fish consumption advisories pose most likely an even bigger risk by depriving overwhelmingly food insecure populations of key sources of N3 polyunsaturated fatty acids. So basically, by synthesizing all of these sciences into a policy relevant decision support tool, we were able to have a pretty big policy impact. For example, with the province of Newfoundland, convening a panel that used our model to recommend engineering interventions to reduce risks from proposed hydropower development. This work has so much more detail than I'm able to present today, and I would love to talk more about it if anyone is interested offline. More recently, my group has been working to understand how basically economic, health, and environmental trade-offs of the transmission corridors linking the US to Canadian hydro resources. And we've been working with environmental organizations and policymakers on the US side. So for example, in a recent project, we demonstrated that a recent transmission corridor to New York City likely had benefits that exceed the impacts, partially because of reduced air emissions, and that those reductions also represent substantial environmental benefits. This also synthesized diverse modeling perspectives into a decision support tool in a way that had high policy resonance. For example, feeding into the New York City Mayor's office, their decision-making over whether to support the project, and the state's decision-making over whether to award renewable energy credits. I've been continuing this work by trying to understand how underserved rural and urban New Englanders value the competing environmental, economic, and health attributes of alternative decarbonization scenarios, as community opposition to renewable energies has played a real role in delaying progress to decarbonization, even in jurisdictions that have really aggressive targets, like some New England states. And so I'm excited to take on this work with social scientist collaborators at Dartmouth and UMass Boston, recently funded by the EPA. And so, yeah, I'll just wrap up with a great big thanks to my large and expanding network of mentors, collaborators, community partners, students, and funders, without whom this work would not exist. Yeah, and I'd love to talk more about it if anyone's interested. Thanks.
Wonderful. Thanks so much, Ryan. You got a lot of exciting stuff going on over there. It's awesome.
Oh yeah, it's a whirlwind.
Good. All right, our next speaker is Haley Stodmeyer, who's joining us from the University of California, Irvine, and speaking on heat stress, aging, and a changing climate. Take it away, Haley.
Hi, everyone. Can you see okay?
Yes, thank you.
Okay. My name is Haley Stodmeyer. I'm a second-year graduate student at the University of California, Irvine, where I'm advised by Dr. Jane Baldwin, who you might have heard from earlier today. This work is also done in collaboration with Dr. Jenny Vanos, who is here, and you heard from earlier today, as well as some amazing collaborators in Australia at the University of Sydney and New South Wales. So this is your grandma, and she enjoys going to swing class. So the climate is changing. Is swing class still safe for your fragile grandma under these changing conditions? That is a great question. Really, what we have here is a framing device to get you to think about some aspects of heat stress that you might not already think about. We know that increases in temperature and humidity are important for heat stress. As it gets more humid, it's harder for the sweat to evaporate from your skin, which is our primary cooling mechanism. However, in order to accurately convey heat stress, we must also consider physiology. The elderly are more susceptible to heat stress, but that's just one way that your physiology can impact your susceptibility, including your medications that you're taking or underlying conditions, things like that. And we also have to understand our physical activity, because swing dancing is more intensive than sitting at home, but maybe less intensive than doing labor. And the more activity that you're up to, the more of heat you're generating inside your body, which will also contribute to your heat risk. So everyone wants to know how hot is too hot, but it's hard to give out a single number when there's so many factors involved. It's also important to note that when we talk about projections of heat stress, we want to focus in on aging here because our population is aging. We have near double of the median age of a person projected by the end of the century when compared to 1970. So even if we had no climate change, we would be more and more susceptible to heat as time goes on. So with so many of these risk factors on the rise, we'd like to know what's coming down the pipe. And we can maybe look at things like wet bulb temperature, heat index, UTCI. You might have heard of these different ways of measuring heat stress when it comes to projections. But my advisor, Dr. Vanos, and some other folks have helped create the Python human heat balance model, which takes this temperature, humidity, and physiology traits of a person, some hypothetical person, and it spits out the level of activity that it would be safe for them to do in those conditions. So this is PyHHB. And so this model is what I'm using to look at CMIP projections. So if we apply future temperature and humidity to this model, we can get a sense of what activity we can do in the future. And we'd also like to account for our aging population. If we tune the physiology to sometimes, we look at young people, and then we also look at old people, we can hope to merge these projections and understand how both of these drivers are contributing to our projections of heat stress and how things will worsen going forward. I have some very, very preliminary work. I'm only a second year, and I'm still very much in the thick of tuning our methodology here. So here we're just looking at SSP245. We're just looking at a handful of models, only 5 CMIP models with 3 hourly resolution. And we're looking at days of the year that are hot, and the way that we choose those days are days above 85 degrees Fahrenheit about. So out of those days, what is the average level of activity that in this plot, what a young person could do? So you can see that this is a 10-year period that is representative of about today. And you can see that this purple color represents heavy physical labor, right? So there's a lot of that purple. Folks are able to do a lot that they want to during these hottest days of the year. If we look at the future 10-year period, we have 2091 to 2100. You see more of this bright yellow color popping up everywhere, which means that even climbing stairs in a lot of these places is going to put folks at risk of heat stroke, even if they are presumably young and healthy. If we instead look at this future period and we tune it to be looking for old people, well, that breaks our color bar a little bit. So if we adjust our color bar, we now see that even things like light household chores in India and Bangladesh and some of these other hot and humid areas of the world could pose a serious threat to elderly populations during those hot days of the year. So all this to say, extremely preliminary results. What I'd like to do is, instead of just looking at SSP245, we'd like to do these projections around different warming levels, which is a little bit more in line with what folks are doing these days. We'd also like to bias correct and downscale our CMIP data that we're using ERA5 data. So that's what I'm in the process of doing now, as well as, of course, using as many different CMIP models as we can to create these projections. And we would also like to do multiple projections where we only include the impacts of climate change, but not an aging population, and vice versa. So we can kind of isolate these two drivers and understand how heat stress is changing from each of these two drivers, which can have implications for what adaptation strategies we might pursue in different areas of the world. So I'm really, really excited about this work, but again, extremely preliminary. Gosh, I don't know if I'm under time or what. I feel like that went by really fast, but happy to take any questions and very much willing to hear input as this is still in its earliest stages. Thank you so much, and feel free to shoot me an email.
Awesome, Haley. Very impressive that you're sharing as a second-year grad student. That's wonderful. Thanks for being with us today. All right, our next speaker is Libby Kulik, joining from University of California, Berkeley. Libby will speak on PM 2.5 exposure disparities persist despite strict vehicle emission controls in California. Thank you, Libby. Go ahead.
Hi, sorry, having just a little bit of Zoom technical difficulties, but
Good.
here I am. Is my screen showing?
Yes, thank you.
Okay, wonderful. Thank you for that introduction. My name is Libby Kulik, and I'm going to be presenting today on behalf of my team of co-authors on our work, which is available as a preprint at the QR code at the bottom there. So our driving question of this work is that oftentimes when we talk about the air pollution and climate mitigation space, we talk about policies as they fall into this double axis of co-benefits between air pollution and environmental health and climate change mitigation. But increasingly, people are becoming much more focused on this potential third axis of policy benefits, which is this equity axis. So our driving policy question here is there, what are the fundamental parts of a policy that allow you to have this triple win for health, climate, and equity? And so there have been a few studies that have looked at this in sort of a future modeling and perspective sense, but we were interested in looking back at a very successful historic policy that has been shaped around these environmental health and climate change mitigation goals. So we're focusing here on California's on-road mobile source emission controls, which date all the way back to the mid-1900s. And even in more recent times, we've seen that emissions of PM 2.5 and precursor species have gone down substantially from the source sector. So our question was, given these emissions reductions, and given that California does have disparate air pollution burdens for people of color, have we ended up in a place that is more environmentally just or less environmentally just? So to do this work, we use a novel modeling pipeline that starts with emissions of on-road mobile sources from the state regulatory model called MFAC. We run it through Echo Air, which is a novel computational pipeline that relies on the InMap source receptor matrix. And we take those concentrations coupled with population and demographic estimates to assess disparity across race and ethnicity. So I'm gonna, with our 5-minute time here, I wanna just focus on some of our major key findings. And first and foremost, we just wanna highlight the tremendous success that this has been from an air pollution and environmental health perspective. Across the 20-year study, we find that statewide average population weighted mean exposure to PM 2.5 has gone down by about 65%. And that those reductions have been seen for every racial ethnic group that we studied here. However, when we zoom in a little bit more on that equity axis, we find that relative disparity in exposure to PM 2.5 from these on-road mobile sources has been strikingly persistent over time. And so just to bring you back to that original question, if we were seeing that sort of more just scenario, we would see that each of these lines would converge around zero, saying that the relative disparity is squeezing and going away. But instead, these lines are very flat, if not slightly diverging by the end of the study. So from here, we wanted to understand what is contributing to this persistent disparity. And so we break down our disparity by vehicle type in 2 different ways. From an absolute perspective, we look at which vehicles are contributing to the absolute amount of exposure and absolute disparity that is being faced. And here I'm just showing results for Hispanic Californians, but these patterns are repeated amongst the different groups of people of color. What we find is that light-duty vehicles are responsible for 60 to 70% of the exposure and absolute disparity, whereas heavy-duty vehicles are the second most important group, responsible for 16 to 24%. But this finding flips a little bit when we focus on the relative disparity by vehicle fleet. So how much more exposed is a group to a vehicle fleet relative to the statewide average. And in fact, here, heavy duty vehicles emerge as the highest, most disparate vehicle type. But focusing in on those absolute disparities a little bit more, we were interested in seeing how spatial scales can play into this. And so if we do a quick little exercise here where we take that statewide finding and we just turn it into a simple pie chart, we're going to zoom in on 2 different regions and 2 different communities in California. First, we'll look at the San Francisco Bay Area and the West Oakland Environmental Justice Community. And then we'll look at the Central Valley and the Arvin-Lamont Environmental Justice Community. And if we look just at these slivers of heavy-duty vehicle contributions, we see that there's a very different story depending on where you are within the state of California. And so in the paper, we repeat this analysis across all 19 of the AB 617 environmental justice communities, and we find that there's pretty substantial heterogeneity. So I just want to end on a couple key insights from the paper. The first one is that it's really, really important that we start focusing on where emissions are occurring, not just the overall magnitude of emissions. So we're finding that if we're just ramping down our emissions, then we're not necessarily going to reduce these exposure disparities. So our call to policy is that, or call to policy action is that we really need to prioritize and target the overburdened communities instead of just relying on this co-benefit model. So with that, I'll end here and invite you to take a look at our preprint, which again is linked here in the QR code. So thank you for your time.
Excellent. Thank you so much, Libby. That's exciting. Appreciate your work. All right, our next speaker is Sarah Camilleri, who's joining us from Northwestern University and speaking on inequitable all-cause NO2 attributable mortality burdens across racial and ethnic population subgroups in the U.S. So go ahead, Sarah.
Thank you. Can you see the full screen?
Yes, thank you.
Okay, perfect. So hi, everyone. My name is Sarah Camilleri. I'm a research associate at Northwestern University at the Department of Earth and Planetary Science. And today I'll be presenting some work on the inequitable NO2 attributable mortality burden that we've published recently. So this is quite a timely kind of conversation given the ever-growing epidemiological evidence linking mortality risks to NO2 or nitrogen dioxide. So starting off from 2016, the Integrated Science Assessment Report has linked NO2 to mortality with suggestive evidence, and this is the basis for the National Air Quality Standards. And then in 2022, Huang Fu and Atkinson have shown moderate confidence in these links, and this has been kind of the scientific foundation for the more stringent WHO air quality guidelines in 2021. And then even more recently, in 2022, the Health Effects Institute report and their traffic-specific report indicate high confidence in the links between mortality and NO2. And these advances have occurred in conjunction with improvements in air quality tools in terms of their spatial resolutions, which are now down to fine scales and able to capture NO2 concentrations, given that NO2 is a short-lived species and exhibits very steep spatial gradients. And therefore, we need tools that are able to characterize these differences in these high kind of steep gradients in NO2, which you can see in the plot on the top right corner. We use here land use regression model at 1 kilometer resolution. And this allows us to then ask questions related to equity, both from an exposure perspective and also from a health perspective, which is the work that I'll be presenting today. Another component that goes into estimating a burden is, of course, the baseline mortality rate. And here we use industrial economic data that is at a census tract level. So we use all-cause mortality rates. And this is an important point because we know that whenever health data is used at coarse resolutions, there's a probability that the overall impact is underestimated. So combining this advances in relative risks and new epidemiological evidence for relative risks with higher confidence linking mortality to NO2, high resolution NO2 concentrations, and as well high resolution health data, we can then estimate for the first time the NO2 attributable mortality burden. We do this at the census tract level, but we can of course estimate a total burden, a CONUS-wide burden, and we estimate that this would be around 170,000 premature deaths per year. But you can see that there's large variability within CONUS. We see that within urban cores, for example, and if we take the city of Chicago as an example, then the rates are about 1.7 times. And this is related, of course, to the fact that within urban cores, we have these high NO2 concentrations that our modeling framework is able to capture. And specifically for the city of Chicago, we estimate that NO2 concentrations are about twice as much the CONUS-wide averages. And then moving on, for the interest of time, to the equity implications that we look at in this paper. Here I'm plotting basically the NO2 attributable mortality rates for different race and ethnicities, and they're shown in the black dots. And the idea here is to see what are the driving factors contributing to the disparities in these impacts. We're looking at NO2 concentrations, and we're also looking at the baseline mortality for different racial and ethnic population subgroups. I'll focus specifically on 3 examples. So if you look at the white population subgroup, you can see that this community experiences lower NO2 attributable mortality rates compared to the CONUS-wide average, which is indicated by the black dashed line. And this is predominantly driven by lower NO2 concentrations. However, if we look at the Hispanic and Latino community, that's the exact opposite result, where we see that this community experiences higher mortality rates attributable to NO2. And this again is, in this case, attributable to higher NO2 concentrations. But if we then focus on the Black community, this is the only population subgroup that both experiences both higher NO2 concentrations, but also is a community that's more susceptible to changes in pollutant concentrations. The baseline mortality for this population subgroup is higher than CONUS average. And this results in higher NO2 attributable mortality rates that are about 47% higher. And I'll finish off with some solutions to avoid the doom and gloom kind of framework. We estimate that if all census tracts had to abide by the WHO air quality guidelines, then the burden would reduce by 42%. And a lot of our current work is related to estimating the benefits of shifting to a cleaner fleet. We show that, for example, trucks have large health benefits, especially for communities of color. And with that, I'll leave you with a summary, and I'll take questions towards the end. Thank you so much.
Wonderful. Thank you, Sarah, for that great presentation. Our last speaker for our session is Ryan Hart. Ryan has a joint appointment between UCAR, NOAA, and CDC, and will be speaking on climatic influences on seasonal onset timing and annual burden of West Nile virus. So go ahead, Ryan.
Thanks, Morgan, and bear with me having a smidge of technical difficulties. All right, let's give this a shot. All right, sorry about that.
No problem.
Are you seeing my screen?
Almost. It says Ryan Harp has started screen
I'm
sharing.
not hearing you, Morgan.
Uh-oh. I think that is maybe a you problem. If you hear me.
I can hear you, Morgan.
I can hear you, Morgan.
Oh, shucks. Okay.
Oh, okay. I think I've fixed it. All right. And you're seeing my screen?
Not quite yet. It says you've started sharing screen. Maybe it's the other screen.
Better?
No, same. It says you started sharing.
All right, let me just share my entire second monitor.
Awesome. Good to
Okay.
go. Thank
All
you.
right, last talk of the day. So, you know, you'd think we'd have technical difficulties worked out by now, but no. All right, sorry everyone for the delay, but I'm Ryan Harp, and I am a NOAA and CDC climate and health postdoc. Today I'll be talking about the climatic influences on seasonal onset timing and annual burden of West Nile virus. So West Nile virus is the most impactful mosquito-borne disease in the continental US. So it's primarily carried by Culex mosquitoes and hosted by songbirds, but people can become ill from West Nile virus. Of the people who do contract the disease, about 8 in 10 don't experience any symptoms whatsoever. 2 in 10 people experience a fever or flu-like symptoms. They probably have no idea that they have West Nile virus. They probably don't get checked out. But about 1 in 150 people do experience a severe neuroinvasive form of the disease, or we'll abbreviate as WNND for the rest of this talk. And due to the severity of these neuroinvasive disease cases, they are the most likely to be properly diagnosed and recorded. So that's what we'll be using as the basis of our analysis. So of note, West Nile virus and its vectors are complexly influenced by climatic factors. I say complexly here because a shift in the climate in one direction can lead to competing impacts. And so on one hand, a rise in temperature can both speed up the development of Culex mosquitoes, but can also, past a certain point, increase their mortality. And so on the right here, I'm showing just a graph of essentially the transmissibility of West Nile virus in 4 different species of Culex mosquitoes. And you can see that there's this peak here around 24, 25 degrees Celsius, where those two factors are in kind of optimum alignment for transmission of West Nile. And just to finish setting the stage, current efforts to produce nationwide forecasts of West Nile have been ineffective. And so this is a conclusion drawn from CDC-hosted forecasting challenges, most recently published by Holcomb et al. In 2023. And this is for a number of different reasons. First of all, most counties do not experience a single case of neuroinvasive disease in a given year. So this makes applying statistics a bit of a challenge. There's also those complex climatic factors that I mentioned. And of course, local forecasts, or not of course, but there's some hope here as local forecasts show some evidence of skill. And so this kind of brings me to where I am currently, which is the first goal of our NOAA CDC partnership is to increase our knowledge on how climatic factors are affecting West Nile virus. So to do so, we're blending disease and climate data. So we have counts of neuroinvasive disease at the county monthly level from the CDC ARPANET, and we're combining that with climate data from both PRISM and GridMet, which are 2 statistically downscaled gridded data sets at about 4 kilometers of resolution. So I mentioned the problem where most counties don't see cases in a given year. So to combat that, we upscale our data to boost our statistical signal. So on the left here, you're seeing a histogram of the number of cases occurring, the log of the number of cases occurring in each county in each year. And of the roughly 3,000 or so counties that we're looking at, about 90% didn't see a single case in 2022, and only 6% see 1 or more cases in a given year. So when we upscale our data, now we're looking at 112 hexes that are roughly 2 degrees latitude and longitude. About 74% now see 1 or more cases per year. And so we've really boosted our location-specific caseload, and that is, again, boosting our statistical signal that we can hopefully use to cut through the noise. So just a real quick sneak peek at some of our results here. So first of all, our main finding is that climate has some location and month-specific impacts on West Nile annual caseload. And so here we're looking at the impacts of June temperature on the annual caseload of West Nile. And this is just showing correlations for 19, the highest caseload hexes. And you can see these positive relationships between June temperature and annual caseload in the upper Midwest into the Northeast. And the inverse is true down near the Gulf into Texas and Oklahoma as well. So there's some spatial clustering going on as well. Another interesting finding is that there's a possible forecast of opportunity over Maricopa County, Arizona, which is where Phoenix is located. And so here, this map is looking at essentially the variability of the seasonal timing of West Nile, and that seasonal timing is most variable by far in this corner of the American Southwest. And of note, that seasonal timing is strongly linked to July and August precipitation, which is driven primarily by the North American monsoon, which has been shown to have some predictability up to 3 to 4 months, which is something that we can use to potentially boost the lead time of our disease forecasts. So with that, I'll just leave with some next steps, which is first of all, that some additional clustering by climate regions might further boost our signal. And that our long-term goal is to merge these climate-informed disease models with weather forecasts ranging from short-term to subseasonal to seasonal. So with that, I'll say thank you and happy to take any questions now, or if you'd like, please feel free to reach out to me at my email address listed there. Thank you very much.
Wonderful. Thank you so much, Ryan, for wrapping us up strong. We are still going to take the time for some questions. So we will take the next 5 minutes. Folks can type their questions into the chat, or you can go ahead, raise your hand, turn your video on, unmute yourself and ask questions. While folks are preparing, I will take the first question. So this is going to be for Haley. So Haley, I often hear folks say like, oh, I'm used to living in the cold, or I'm used to living in the hot. So I'm wondering, like, folks in Alaska who might be more comfortable living at cooler temperatures than maybe folks in Southern California, is this something that gets factored into your models? Like, is there a true thing like situational conditioning to your environment? Or is that more so like a saying that we hear?
Yeah, so we do factor in acclimatization into our physiological model, that PyHHB. So essentially, if you are acclimated to heat, then I believe it's your like the rate of sweat that you produce will increase as you're more used to it. So that's one of the parameters that we can tune. My work is following up on a publication from Dr. Vanos and Dr. Baldwin and some folks that was published last year. I forget off the top of my head whether or not they were assuming folks were acclimatized or not. But that's something that we'll have to consider when we're trying to create a representative physiology. Obviously, we're trying to look at the age differentials in physiology. So I know that we were, if you saw Jenny's talk earlier today, I believe she said that she was looking at like 48 different permutations of the different physiology aspects that you could have. So really the sky's the limit as far as the different parameters that you can tune and do your analysis on. So while that might not be the focus of my analysis, it is something that we consider.
Cool, great to know. Thanks for that information. Any other questions from the audience? All right, I have another one. This is jumping back up to Miriam. So Miriam, I was wondering if you could explain more about how you mapped out the wildfire urban interface areas, like what factors go into defining that?
Absolutely. So one of my collaborators on that project is Volker Radloff at the University of Wisconsin-Madison. And Volker has done excellent work over many years that is using satellite data as well as census data to define the wildland urban interface. So we can look at where vegetation is occurring and then where people are living. And I didn't have time to get into the nuances of this too much, but there's different types of WUI, whether where people are living is intermixing, or the interface between wildland vegetation and housing. And both types of that WUI area is split apart in his data set. So we're building on some of his foundational work that he's done.
Excellent, thank you. Any other questions from the audience before I selfishly take another one? All right, so Ryan, this one's for you. Hexes versus counties. This is interesting. What are your thoughts on, pros and cons of analyzing climate and health data on geopolitical boundaries versus non-geopolitical boundaries? Because a lot of the decisions and health data end up being made or collected on geopolitical boundaries. So interesting to hear your thoughts on that.
Yeah, what a great question. And I think a lot of this depends on the exact health outcome that you are interested in. And so for us, we're looking at West Nile, which has a relatively infrequent case count, compared to other things like the impacts of air quality or extreme heat, things of that nature. And so we've gone on to, like I described, upscale onto this hexagonal grid in part to try to combat that. As if we just focus on the county level, there's just not enough cases for our statistical analysis to really come through, which I think is, as I mentioned, one of the reasons why the West Nile virus forecasting community has been struggling to really beat essentially the historical, a forecast just derived from historical trends. And so I think broadly speaking, it's a great question. I think a lot of it comes down to the specific outcome that you are looking at. And for us, we by necessity are looking at this higher level of aggregation.
Great, thank you.
I have a question for Ryan Calder, if that's okay. Ryan, I'm part of the Climate Justice Initiative here at UCI, so I also do some community-based research on the side, and so we've been talking a lot about Indigenous communities and how to involve communities in community-based participatory research to ensure just and equitable outcomes. So I want to hear a little more details on how exactly the Indigenous communities that you were working with got to have a say in the design of your research, the questions that you asked, and the policy recommendations that you made, and how you kind of fostered those relationships.
That's a great question. So the Inuit of the Labrador Coast are represented by the Nunatsiavut government, which is a pretty well staffed and well-resourced entity with a science director and a lot of infrastructure to coordinate interactions with scientists. And so how that project started is they actually, this is my PhD work, and they reached out to my PhD advisor, who was a methylmercury expert, and asked for some scientific support. And it sort of kept building up and building up and building up in scope. This was also, the methylmercury stuff that we did was just a fraction of a bigger scientific agenda that they were coordinating with other scientists at Memorial University of Newfoundland, University of Connecticut, University of Manitoba, to develop a better characterization of the likely social, environmental, economic impacts of the Muskrat Falls hydroelectric project. And so we worked closely with the scientific staff at the Nunatsiavut government, as well as collaborators at other universities who were looking at different but related questions. And so it was kind of an iterative process. We worked very closely with them on study design. We were involved in creating interim sort of policy support documents. We, before we published anything, we, got their opinion and made sure that they were involved in every step of the way. I would say it was led primarily by them. And if anything, we were kind of scientific support for the agenda that they had put together. And so I think it was a very successful and sort of Indigenous-led effort. And yeah, I think it went really well and sort of been a template for future work, in my opinion. Does that answer your question?
Yes, thank you so much.
Okay, no problem.
Great question, Haley, and thanks so much, Ryan. I think now I am going to turn it over to Daniel and Jenny for our closing remarks for the showcase today. Thank you to all of our presenters in the last session. Appreciate it.
Thank you, Morgan. Thanks everyone for this exciting talk. It's really a treat for me. I think you cannot easily come across such a great meeting in a very short time. You have all these highly information-intensive talks handpicked by all the session chairs from 2 major conferences. I think for those of you who are lucky enough to join us today, you all agree. This is really a treat. You're ready to come across. So I want to have very briefly 2 slides to wrap up on behalf of AGU GeoHealth. So first, I want to call for your attention to the session proposal that's right now is open for AGU 2024, which is in Washington, D.C. So hopefully you can consider submitting a proposal, either you are a senior scientist or an early career stage. We especially encourage early career scientists to consider lead a session, and we will be happy to pair you up if you need help with anybody else. The second item I want to bring up is a community service. So what a meteorological organization right now is organizing a new initiative called Air Pollution, Climate Change, Health Effect and Access ARC. So they are seeking information and also involvement for geo-health related projects. If you have a project and you like to have some global spotlight, or you want to get involved with this new initiative, you can fill out the survey. I will put both links in the chat after my talk. So you will, if you're interested, you can take a look. Well, finally, I just want to say, nothing's going to happen without the leadership. We really want to thank the showcase organizing team, including Azza, Jenny, and Hunter, and all of this, Jenny, Jen, Morgan, Corinne, wonderfully chairing the sessions. Metro was very busy behind the scene, texting out, tweeted out on social media. So some of you have become famous. And Han and Yichin, they're doing a very, I would say, underappreciated work, but it's how they keep our meeting on schedule. And Ben and Kai are not with us today, but they are doing a lot of work behind the scene. And finally, we want to thank AGU staff for providing the logistic support for this workshop. Yeah, please join me, give them a round of applause. I'm going to turn the mic to Jenny, to wrap up the meeting on behalf of AMS.
Thanks so much, Daniel. Similarly, I want to thank so many people for being part of this. Thanks for everyone for being here. We showcased 27 talks today. 3 of those, the larger keynote talks. So very happy about that. And then all these lightning talks. And one of the really important things about this is that a lot of people can't go to both AGU and AMS. And we're able to make a selection of some of the most prominent talks from our conferences and highlight them here in a way that everyone can access them. And they will be, Azar will share after this, they will be posted after for other people to see. So we think that's really important for sharing and having inclusive science here. Looking forward to the future, we do have our AMS 2025 conference held in New Orleans next January. So hopefully some of you can come to that and look into what our environment and health conference will be planning right now. Their session topic proposals being accepted for the 16th conference on environment and health that cover wide-ranging topics, all of the topics covered here today for sure. And the theme of the entire AMS conference is towards a thriving planet and charting the course across scales. So thinking spatial temporal scales that have been talked about a lot today. And so you can submit an abstract or a session topic proposal. The QR code is there, and then look forward to the individual abstracts that will be due in August for presentation at AMS. And I think that's all I wanted to say. I'm the outgoing chair of our board. So Hunter Jones, who did the welcome this morning, is the new chair of the AMS Environment Health Board for the next 3 years. So with that, I'll turn it over to Azar to wrap it all up.
Thank you, Danielle and Jenny, for those final words. It's been a privilege to share this day with all of you. Keep an eye out for the recordings. We will share them on the social media on both AMS and AGU. And wishing everyone a wonderful afternoon and evening. Thank you for being here.
Thanks so much.
You.
Thank you. Thanks, Azar.